Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about the offerings of Elder Services of Cape Cod. And we're lucky enough today to have as our guest Paul Wild. Thank you, Paul, for being here. Paul is the Contracts and Customer Service Manager.
That's right.
Good. Thanks for being here.
It's a long job title.
Yeah. Like our name. They just keep getting longer.
They
right?
do.
Yeah.
And it's Cape Cod and the Islands.
Oh, it is Cape Cod and the
That's
Islands?
right. We serve all
Thank
three
you.
counties.
Yeah.
Dukes, Barnstable, and Nantucket.
Wow, I didn't know that.
Yeah.
Oh.
So it's 22 towns. And we're a kind of an unusual entity. We're not a state agency, and we're not a private company. We're a little bit of both.
Okay.
We're a community-based agency, and our bosses are all volunteers. The board of directors is at least 50% seniors, or people that work for senior agencies.
So they understand.
So they understand the needs.
Yeah.
And as I say, it's community-based, and we have two designations. One's from the Commonwealth, and that's ASAP, Aging Service Access Point.
Okay.
And the other one is the federal government, and we're a AAA. Area Agency on Aging.
Wow.
So we have two designations, and we're considered to be the open door, the gateway for elder services of all kinds, for and by elders. So it's not only services to help elders, it's services that help the community from elders.
Oh, yeah.
Yeah,
So
we are full
ways.
of great opportunities for people who are in their senior years who need a specialized volunteer opportunity or want to give back.
Yeah. Well, here, I'm going to start with...
All right.
That's okay. I'd like to have viewers know a little bit more about who's Paul Wild, what got you into this, how long have you been here?
Well, I've been at Elder Services for a quarter of a century. Imagine that.
That just sounds like a long time. 25 years, that's not that long.
Yeah, it's not really when you're an elder. I'm just getting my credentials now.
Is that right,
yeah.
for being an elder?
Yeah, because a lot of the clientele we serve are in their 80s and above. Wow. I always loved Cape Cod. My dad worked for General Electric, and we moved around the country. But we always came to Cape Cod in the summertime.
Oh, yeah.
Pretty glamorous place. And I've always wanted to work for Elder Services. I was interviewed by the very first executive director back in the 70s. So, but I've loved my time here, and I expect to work a little longer.
Yeah, good for you. Before you switch over to being on the client side.
That's right. Before I become a recipient.
That's right. So now Elder Services is a huge program.
Yep.
You think of you mentioned the three counties that it serves.
That's right.
Okay.
And so a lot of people, I could talk a little bit sometime about those volunteer opportunities, but I think what we want to talk about today is the clinical services.
I would say just so people have a general...
These are the services for elders.
Yeah, the viewers have an understanding.
And I think probably the most commonly known one is our senior nutrition program, which everyone knows as Meals on Wheels.
Oh, Meals on Wheels, right.
We deliver 825 meals a day.
Wow.
Yep. We serve meals to anyone. This is a federal program. Okay. And there's no means testing, so it's eligible for anyone. You only have to be homebound in a medical sense, in that it's a taxing effort to get out of the house. Okay. And you can't cook. And so we provide around a third of the daily nutrition. But even more important is that safety check. Oh, okay. We have one of the last all-volunteer delivery programs in the Commonwealth.
Is that right?
1,100 volunteers.
Wow, good
delivering
for you.
Those meals.
Delivering those 800 plus meals a day.
825 a day. And at the end of the day, we know where every single one of those 825 people are, even if they weren't there. Because for some reason, we showed up and they didn't answer the door. Right. We'd be concerned about that. Yeah. So we have a very elaborate process to make sure by the end of the day we know where they are.
So there's a system in place. So if a volunteer...
worst comes to worst, we'll send the police for a well-being check.
Yeah.
And we've had to do that. We found people on the floor who needed us, and we saved lives through that program literally every week.
Right. So is that a breakfast, lunch, dinner, once a day?
It's a once a day meal. It's delivered in the late morning.
Okay.
It can be delivered hot if the person can't heat it up.
Okay.
You have to be over the age of 60. And it's frozen, so it can be heated up in a microwave or in a conventional oven.
Okay.
But as I say, if you can't heat it yourself, it can be delivered warm.
Yeah.
And then we delivered 3 meals on Friday, one for Saturday and one for Sunday.
Oh, so Friday's a big day.
It is.
Yeah.
And then we also send out ahead of time a shelf-stable meal. So in case our 1,100 volunteers, we wouldn't put them out in a snowstorm.
Like the last few weekends that we've had, people not on the road. Yeah.
Meals, and they don't even light the electric can opener. You can just tear off.
Oh, yeah. So. Do you find the clients are pretty dependent on these meals? I mean, it is a big part of their
yes,
survival.
It is, and I'm afraid sometimes. This program was started about 30 years ago because seniors didn't have primary nutrition. Oh. Those were the days we heard about elders eating cat food.
Right.
It's not so prevalent anymore, but there are people who have trouble making ends meet. And this meal is not only because they can't cook, but sometimes they can't afford good nutrition.
Right.
Now, the senior program also has congregate meals. So we have about 22 meal sites across the Cape and the islands serving the same menu, but if you can't cook, but you can get out of the house, generally they send a bus for you, and
nice.
You eat with other seniors.
Yep.
People eat better when they eat in groups.
Yeah.
And eat more. So it's a well balance, and we have to provide a third of the daily supply, and we have a nutritionist and a dietitian, but we use federal commodities, so it's not a really specialized diet.
Right.
But we can accommodate people who can't have sugar. We have fruit for dessert.
Oh, yeah, yeah. So that must be great from the social support aspect of getting people out to the meals.
Exactly. And the meals, if you just get Meals on Wheels, you also get a nutrition care manager. So someone comes out every once in a while, make sure the meals are meeting the needs, and see what else the elder might need.
Oh, yeah. So it gives them an opportunity to check the environment.
That's right.
See if
there's wraparound services. So that leads us to probably the largest in dollar amount program that we have on the Cape, and that's the state-funded home care program.
Okay.
Now, we spend $8.5 million a year on Cape Cod and the islands for services for elders. So we bring...
And is that federally funded, did you say?
This is state-funded.
State-funded, okay.
Now, a lot of that money comes through the state from the federal government.
Okay.
A lot of Medicaid money, which is called Mass Health in this state, starts at the federal government, goes through the Executive Office of Elder Affairs, and then down to us.
Okay.
But these services are not like VNA services, which are skilled services.
Right.
These are called custodial care.
So skilled for the viewer. So a skilled service would be nursing
with a
care,
nurse or a physical therapist or something.
Wound care.
We're talking about
like that.
homemaker.
So this is homemaker.
Or a personal care attendant.
Home health aid would be
home health aid if you needed that.
So they actually have hands-on.
They can do some hands-on care.
Certification.
Exactly.
Yeah. Okay.
And lots of our clients, it's not treating a medical condition, it's supportive getting
help
in and out of the tub.
Dressed, in and out of the tub.
Exactly.
Okay.
Bathing, grooming, ambulation. But the homemakers do housekeeping, shopping, laundry, meal preparation, bathing and grooming, that kind of thing. And the Commonwealth gives us about, for our basic client, $250, $275 a month for services.
Okay.
Boy, that doesn't sound like very much money, does it?
Right.
$250 a month? But that $250 can keep many elders safe in their own home, and a heck of a lot cheaper than going to an institution.
Right.
And so it not only helps the taxpayers in that it's cheaper, but most people want to stay at home.
Yes.
So
that's what we find.
It's good both ways.
Yeah.
So
what is that, for an example, it would be someone would visit them once a week?
Yeah, so you'd have a homemaker once a week to do the housekeeping, strip the beds, wash the sheets.
Oh, yeah.
Generally, we like, because Cape Cod is so spread out, we have delivery services for laundry and grocery shopping.
Okay.
So the homemaker hopefully can spend her whole time at the consumer's house, do the toilets, mop the kitchen and bathroom floors, as I said, strip the beds, do some meal preparation. Plus, we have a grocery shopping service, laundry service. Many of our clients have a
Lifeline, whatever.
Lifeline is the brand name, but we call them an emergency medical system.
Okay.
And we like to pay for that too, because that's a nice safety check.
Yeah.
Especially if someone's
alone. Is that something
alone.
that's recommended by Elder Services once you go in?
Yeah, that's a really good question, Jeanne. Basically, we don't purchase the services directly, with the exception of those meals. We buy them. And what happens is that we have the care managers to determine the client's eligibility, and in conjunction with the client, cook up a care plan. And then they come back to the office, the care manager does, and selects our provider agencies, which, and here's where the VNA of Cape Cod comes in. We actually have a contract with a contract services division of the VNA, and they're fine homemakers and personal care attendants and home health aides help our clients with housekeeping and shopping and laundry. Also, quite a few other provider agencies. There's 53 of them all told.
Wow, yeah.
So that's the contracts manager. That's my job, is to manage these subcontractors that actually provide the services.
Wow.
So our care managers go out every 3 months, make sure the services are right, and maybe tweak them in and out, up or down. And then if the client's aging in place and their needs have gotten significantly higher, we have 2 graduate programs, enhanced service packages. So this is the idea, is the consumer's getting to a point where they could be in a nursing home.
Right.
And without our help, they would be in a nursing home. Then they're eligible to graduate for an enhanced program. And if they happen to have Mass Health, which is called Medicaid, the service plan can be pretty elaborate, up to daily or twice daily services.
Wow. How many clients, just for fun, do you think you have on
a couple
the
of thousand.
Wow.
Yeah.
Well, how many clients do you have in general?
Well, there's 80,000 elders on Cape Cod.
Okay.
So everyone on Cape Cod is our client, because some services we serve the entire Cape. For instance, information services. I told you we were a federally designated AAA.
Right.
As part of a AAA, we are mandated to have a telephone line that answers any question about elders. And I supervise that as the customer services manager.
Okay.
We have 3 information specialists. They're all certified. And they can tell you not only what services are available if you live in Harwich, but if you happen to live in Santa Fe, New Mexico, where to get Meals on Wheels. So we have a lot of elders here whose families are away.
Someplace else,
or vice versa.
Yeah.
We have people here whose family are in Florida.
Yeah.
So we work a lot with caregivers as well.
So the 3 information specialists, they're the ones that run those phone lines, field all those information calls.
That's right. So my job includes not only the information department, but the front end desk.
Okay.
And we are dedicated to having a live telephone operator answer our telephone.
Yay.
So when you call Elder Services, there's a nice, happens to be a lady.
Isn't that great? That doesn't happen much.
Exactly. And we're dedicated. We have, our board and our staff are committed to staying with a live voice and not a telephone triage or a voicemail kind of jungle. Because some people are kind of just starting out.
Right.
And Cape Cod's very good for independent people who like to avoid asking for help. Sometimes till it's pretty late.
Yeah.
That's the trouble is that independence is a good thing unless it becomes an unsafe situation.
Right.
So that leads us to another real important service of elder services, and that's called protective services.
Okay.
So we run the Elder Protective Service Program for those 3 counties, and that's for any elder that anyone has a suspicion that they're being abused, neglected, exploited either sexually or financially, or even more important, self-neglect. So if someone is unable to really take care of themselves, anyone that has a license, a doctor, a nurse, a social worker, policeman, fireman, they're all mandated to call us and file a report of concern.
If they find anything or see anything.
That's right, and we have investigators. So we go out and verify before we open a case, and then...
How does that work? Do you just visit the house or call ahead?
We have strict guidelines around time, and our protective services workers reach out to the consumer or the alleged victim and attempt to find out what's going on. Every once in a while there's a bad faith report, and we want to make sure that we're investigating something that's really happening.
Right.
And then we have to operate with consent. So if someone is self-neglecting due to, say, substance abuse, and they don't want to change, we have to regard them. If they have the capacity to make decisions, even if it's a bad decision, we have to go along with that. So this is a big change in the way our community is operated, in that more and more people are aging in place in the community, and nowadays freedom trumps safety. So sometimes there's unsafe situations, and we just have to try to work as best we can with that.
So the people that are certified, as you had mentioned, or licensed, doctors, police, firemen, nurses, anybody that would see anything that could report to you if they felt somebody was unsafe. What about, regular guy on the street, my neighbor, I can hear somebody yelling at them all the time.
Well, no one is prohibited from calling. Those people that with a license have to call.
They're required to.
But anyone should call, and it's an ethical thing, you should.
Good.
And I think it's a very good question, Jeanne, because you should know that we're experts at this. Your report will be anonymous.
Oh, that's good.
We never reveal whoever makes those reports, ever. We never reveal that. And you can make a report anonymously. Even if you tell the intake worker who you are, the intake worker won't put your name down in the report. So, and as I said, first the report is made, then it's screened to determine how fast we should approach it, routine, rapid, or emergency. Sometimes they have to get right out there. And then we do some investigation to decide whether this is a real problem, is it a serious problem, does the elder want us to help them with a problem. If all these things are in place, then we open the case, and then we try to help them by, well, sometimes it's a family situation, we'll recommend family mediation. A lot of times it's an exhausted caregiver. If you are a daily caregiver of someone with dementia, it can be tough. And some people aren't aware that we have the services to help them. So we have a whole caregiver support program, for instance.
That has to be special people that go and check on reports like that.
They are. They are pretty darn special. But I have to say there's a lot of people that work in elder services pretty vested in the mission. And the clientele are pretty darn nice.
That's good to hear.
Which is a good thing, because that's what, 25%, soon 33% of our citizenry
our population
here. So it's a special place to be an elder here in Cape Cod.
Right. Wow. So that's quite a few services. So you went from Meals on Wheels to
Meals on Wheels, information, protective, that caregiver support program. So that's a federal program. Once again, no means testing for that. And we go out in any situation where there's an elder. The elder may be the recipient, or more and more, it's an elder giving care, a grandparent parenting grandchildren,
there's a lot
because
of that,
the generation in between has been incarcerated. That's a sad situation.
Yeah.
And some elders are kind of overwhelmed inheriting their grandkids to parent.
Right,
so
right.
we offer help with that. We offer help with people who are providing daily care for dementia. We offer support groups. We offer what we call habilitation assistance. That's specialized psychotherapy from specialized people that work with dementia, show caregivers the tools they need to stay on the job.
So do you subcontract with agencies that go and provide this service? You know, like you do with the VNA, are there other subcontracts so that, say, the psych services could go out and help?
Yeah, we actually have several contractors for habilitation therapy. We have a contract for behavioral therapy for people with psychotherapy
I mean,
needs.
as opposed to being fully staffed yourself with all these kind of people, it's just so diversified, it would be hard to be that way.
That's right. We do have to have specialists. And our protective services, for instance, will need specialists in various areas. Financial exploitation, that can be pretty specialized in erudite, and we need accountants and forensic investigators. So yeah, we do have to farm out stuff. Medical competency. We were talking about protective services and the right to refuse intervention. Well, that's based on someone's capacity to consent. And whether someone has the capacity to consent is really up to a judge and a doctor. So we have to get a doctor to help us decide, and then we have to take it all to a judge to see if someone needs a guardian or a conservator.
Yeah. That's a lot of work involved there, Paul.
There is.
Wow.
So we also, services for elders, we help people with money management. We have a whole money management program.
Oh, I think I had one of the volunteers that volunteered for the VNA also did some volunteer work for elder services, helping somebody with their checkbook every month.
That's right. This was originally a program designed to help people with a handwriting or a vision problem.
Okay.
And it sends a specially trained volunteer to the house once a month to reconcile that checkbook. But since the turn down in 2006, we've ended up with people not only with handwriting or vision problems, but real, what do I do now?
Cognitive,
my income is not as high as my outgo. So we can't do financial planning.
Right.
We try to help people who are getting underwater, and we want to forestall homelessness. And people must be paying their bills, and when someone comes in and sees bills not being paid, you know, we want to, if that's the only thing that keeps someone, if that's the only problem with someone staying at home, that's just a little thing that we can do to keep them
makes a big
home.
difference, an easy fix makes a big difference, Now, it sounds like, believe it or not, we only have about 5 minutes left, so I want to be sure.
Oh, it would go fast.
I know. I want to be sure people understand, is there a charge, is there a fee involved with this? Or?
Well, that's a very good question. There is no fee for any federal program like that family caregiver consultation or the Meals on Wheels program. The meals are actually on a voluntary donation basis at $2 a meal.
Nice.
So we don't
bargain.
count. Yeah, that's a pretty bargain.
Yeah.
Especially since it costs $7.50 a meal to get it there to the door. So we're only asking $2 out of the $7.50. Now, for the state-funded home care program, people up to the poverty level don't pay anything. Once again, that's voluntary.
Okay.
And then people from the poverty level to around 300% of the poverty level pay a flat fee per month. And it starts at around $5 to $8 and goes up to around $100.
Wow.
So even at the top level, you pay $100 for around $250 worth of services, plus free case management.
Right.
So it's pretty much a deal.
Yeah.
And then we have a respite care program, which is if you're a daily caregiver of someone with dementia and needs respite, you can have some supportive services. And once again, that's a sliding scale.
Okay. So someone would come in, give you a break, you can go get your hair done or get some groceries or whatever. Yeah.
And this has been all pretty complicated, but all you have to remember is that one number, because our information specialists can walk you through all the stuff we've breezed through today.
So if any viewers are out there, they know someone or they feel themselves like they could use some help.
Or you want to know more about the services.
Yep, they can do a one-stop call to you.
The information department's open 9 to 5 business days. And our toll-free number.
Sure.
Are you ready for it? 800-244-4630. That's 800-244-4630. And that's anywhere in Massachusetts, and that's our main number in South Dennis here.
Okay, very good. Well, Paul, thank you so much. What a load of information. Hopefully everybody can process this. It'll be familiar to some, because I know there's a lot of people at home that depend on your services, and Meals on Wheels, I think, is fabulous. I've heard great stories all the time from people that are part of that. So
thank you.
There's very good work that's being done.
We love what we do.
Yeah, you can tell. Yep, that's great. So, I am Jeanne Sarnosky, wishing you good health and good health care.